the earlier speakers have really set a stage for me, and I will be moving towards another side of the spectrum to talk for another 10-15 minutes or so. So just be patient and let's see what we come out of it. So we see these in the newspapers, and it's coming up continuously. These were the dawn picks for this year's, which is highlighted. And as the earlier speakers have said, this is only when it is highlighted and the cluster is there of the HIV positive people, then it only shows up. What's happening behind? What's the whole health system is doing? Especially, I will be focusing on the laboratory side up. What's happening there? We really need to understand that, because all the speakers have talked about screening, and it's really important. But how? So why testing matters? The number one question. And it's really important to test, as we all agree upon it, but it could be a life-changing thing for a person. So we really need to understand what it will lead up to. It could endanger the relationships between a family. A brother won't talk with a brother. A father would ask, where did you get it from? It could lead to problems in marriages or future marriages. Employment. Would you hire an HIV positive person? Social standing. We really need to think about that. The social standing of a person if he comes out to be positive. Housing, getting a house, living in a community, getting something on rent, all these things matter. Important, we all are healthcare professionals. So access to healthcare, we talk about HIV centers, we talk about getting them enrolled in the ART programs, but do we provide them the access to healthcare? Can an HIV person get a routine surgery as a normal person can? We really need to think about that. Community standing. If a community comes, like we have seen in the pictures from the earlier speaker, what happens to the stigma and discrimination and all these factors are involved? So then comes the question, who are being tested? Definitely the high-risk population, injectable drug users, the transgender, the sex workers, TB population. There is now a trend of getting TB population screened also. Pregnant women, blood donors, we talk about a little bit about that, and patient undergoing procedures. Is this the only population which has been screened? Or other cases? Now you will see, I have seen a trend, that the GP writing hepatitis B, C and HIV as a routine test. Does anybody ask a patient that consent is a whole procedure? And is voluntary anywhere there? Or if you get admitted to any hospital and they just write these tests and the patient doesn't know, because as we have discussed, it could be a life-changing thing for a person. So we need to think about that. So in Pakistan, when we talk about the laws, it's a remarkable country. Health is a professional subject. When we talk about National AIDS Control Program, and Sindh has its own, and every province has its own domains. So there is quite a heterogeneity. And I don't know, personally I feel, we are not on a single page. The whole Pakistan is dispersed. And that is a really big problem. Fortunately, living in Karachi, living in Sindh, we have since AIDS Control and HIV Prevention Program Act of 2013, which has answers to many of these questions of discrimination and stigma, along with HIV testing, along with getting them enrolled. So just it says, according to that, it is this since AIDS Control Act of 2013, it says that it is unlawful to require or coerce a patient to HIV screen for the purposes of employment, membership of any organization, getting admissions into schools, we talk about people are not getting admission if they are HIV positive. Admission of public or private accommodation, marriage, and for immigration or immigration or citizenship of Pakistan. This sin says, what about the rest of the country? Similarly, no person should be screened without their express consent for routine testing or diagnosis purposes in any public or private care facility. So, when a health professional writes these tests, a doctor prescribes these prescriptions, and a GP writes in a clinic, does he know what he is writing? Does he know the implications of it? That he understands it? We really need to think about that. So, the most important thing for me right now is to create more awareness about the healthcare professions at the start. Okay, test is being done. Then what? We see these pictures. On the front of the file, it's written this status. Or this one. It is a common sign. If I'm asking about somewhere else, in another word, no, this is a reality of each and every, not every, but majority of the hospitals in our country. So, how can you prevent the stigma and discrimination when we talk about it, when this is happening in our healthcare facilities? So, when we talk about the confidentiality, does it get lost anywhere?
Yes.
So, and confidentiality is the building point for the trust. And we all know, as a doctors and healthcare professionals, trust is the main thing. If you don't trust your healthcare professional, if you don't trust your doctor, things won't work out, medicines won't work out. So trust is the basis thing. And trust leads to what? Trust leads to willingness to test. And willingness to test leads to early diagnosis, which is as we have heard in the previous presentation, early diagnosis is a really challenging thing for our country. It leads to treatment if the diagnosis is there. And it leads to viral suppression. And viral suppression leads to reduced transmission. And what we want to achieve as a public health, we want to achieve zero transmission, we want to reduce the transmission, that's our goal. And this can be achieved through confidentiality and privacy. If we lose that point, the whole system breaks down. And in confidentiality is breach, it leads to no follow-up, patient don't come up for the treatment, failure to seek assistance, and more chances of spreading. When we talk about the confidentiality in the laboratory, it's really important to understand that. So, as we talk about science and ethics are not different. When we go to a laboratory mindset, we talk about everything about pre-analytical, analytical, and post-analytical things. When a sample comes to it, something similar happens over here when we talk about the confidentiality in a laboratory. So, request for a test comes. If I go for my HIV test to any lab counter, what will they think? Why Dr. Saab, he knows everyone knows me in my hospital. क्यों है डॉक्टर साहब? डॉक्टर साहब या तो बाहर जा रहे हैं या इनको नीडल स्टिक इंजरी हुई है. We presume what's happening. So, when a request is generated, it needs to be confidential. Similarly, the specimen collection. When an HIV test and the sample is being collected and labeled, we need to think about that. When we talk about the analytical steps, conversation about among the staff. When an HIV comes positive, does the colleague needs to know? Is it on the paper or is it on the result verification? Who is verifying the results? Dr. Amir says what has happened in the lift of the SIUT for a particular test. This is a real example what usually happens. So, post-analytical phase, electronic records, when we say paper record is not there, who has the access to the record? Is the computer screen on? Anyone is looking towards it? Similarly, printed reports. Where are the printed reports being kept? Are they kept on the counter? Similarly, telephonic communications. Should this happen with HIV telephonic communications? We know there are emergency situations. We need to dialyze a patient. We need to do an ER surgery, emergency surgery. Everything is, but does this need to be happen on a telephonic conversation? Result collection. Who is collecting? We are in a Pakistan. We are living in, every person is in a combined family system. Who is collecting the report? कोई uncle आया है? If there is an uncle who is collecting the report, or a far-flung friend who is just collect my report from the lab. Who are we handing these reports to? Data storage. Where the data is being stored. Who is the owner of that data? And similarly, when we talk about the surveillance, the public health needs to know the data. But how should it be circulated among? How should it be given to the authorities even? We need to think about that. I'm not deliberately not talk about the research thing because I want to just keep it out because it opens another domain altogether when you talk about HIV research. So when we talk about the disclosure, before disclosure, we should ask ourselves, why am I disclosing? Whom am I disclosing to? Am I disclosing this to the clinician? Will this help the patient? Or it will be another sign of stigma and discrimination? Is the disclosure authorized? Has the patient given the consent to disclose this information to anyone else? Can the purpose be achieved without identifying? My department, the institute wants the data of all the HIV. Should I give the whole data with the name, the CNIC, the telephone number, and the status? My institute just wants the data, how much, my lab, how much they tested for it, how much came positive, how much does in it. Do they need to know all these informations, the institutions or anyone else? And similarly, what is the minimum information necessary which needs to be disclosed? This is a very important minimum disclosure should be the standard to follow. What about the spouse? Because when we talk about the disclosure, it's always talk about the partner, how the information should be given to the partner. Because confidentiality is at one point and prevention to the harm to the partner, which becomes another point for the public health also, because now it's spreading, the disease is spreading. So we need to think about it. And the rule is counsel the patient and encourage voluntary disclosure. And I've talked to the specialists, the counselors also, and they say when you properly counsel the person, they usually disclose. When the family is involved, they usually disclose. So voluntary disclosure should be there, should be aimed at, and it could be achieved by proper counseling, proper guidance. And if not, then the SIN HIV/AIDS Treatment Protection Act guides about this also. It has given 4 steps for the disclosure of the partner also. And it's a really excellent act which could be followed, at least in the province, could change the real life situations. Then comes the unauthorized disclosure. When we are sitting in the lab, when we are sitting in our hospitals, the act, it is a criminal punishment for an undisclosed disclosure. So if you publicize health information in contravention to this, you are liable for imprisonment not exceeding 5 years and a fine of 200 rupees, 200,000 rupees. So does anyone know about it? So if you do a disclosure, you are liable to go. And similarly, this act also protects from non-disclosure. If you don't disclose your identity, it leads to exposure and risk of transmission, then again you are liable. Right? Then comes the public health surveillance of HIV, which is really important and it matters. Health authorities needs the information. Why? Because to allocate resources, the resources are shutting down. What is it HIV issue in Pakistan? If no, the numbers are very low, we don't need to invest. We need to invest in malaria, we need to invest in TB. But if HIV is a problem, then we need to invest on that. So allocation of resources is important. If we don't know the data, we can't do that. Understand the transmission patterns. When the cluster epidemic is there, when the cluster is how the transmission occurred. Identify outbreaks in clusters. We need to plan for prevention strategies. We need to know how in our population the HIV is taking the route. So we need to plan in that, we need to have the data, monitor trends, and most important, evaluative measures. We are investing, and if we are not evaluating, then no use. So the data needs to be generated. But this could be directly in conflict with the privacy and the confidentiality of the patient. At one point we said the privacy and confidentiality leads to public health. But if we give the data, like if we expose the privacy, confidentiality, it is in conflict. So what's the solution? We need to ask who is requesting it. कौन मांग रहा है data? Why is he asking? Is it a legal authority? Or if any organization who is working on HIV comes to my lab and asks for the data, should I pass it to this organization? What is the authority of it? What is the purpose? Why do they need the data? Is identifiable information necessary for them? Can anonymized or coded data be used? And how the data will be protected? It's a very important thing. Whenever you hand over a data to even the government authorities, how is the data being protected? You need to ask. We have seen in COVID miserable things happening. Puri data sheets are transmitted on WhatsApps. Is this the way to move forward? Or we need to have some really secure systems for this kind of information to be shared? And who will have access in the end? The rule is minimum disclosure. If we do with the minimum disclosure, it helps your solution. By asking these questions to yourself, you can lead to a better outcomes. So, sitting in a lab, what are the responsibilities of a lab? Number one, to have an accurate results. If the HIV status is wrongly reported, you can see it could change the whole life of a person. So we should have an accurate results. Seeking testing safely. The HIV testing should be in a safe environment. Nobody needs to know. It should be a routine procedure if it is being performed. Universal precautions should be taken everywhere. Confidentiality should be maintained. Appropriate communication. When you get the results, you need to appropriately communicate to the patient, to the clinician, to the health authorities, to the partner if required. Data security from the LAMP point of view. And the next step when you move towards the treatment, it's our duty and responsibility to give the appropriate referrals where they will be getting the treatment once the test is being positive. If a GP performs an HIV test and if it comes out positive, does he know where to send the patient in our community? So awareness and education is the most important part. Receiving counseling. Access to ART. This is the responsibility when you test someone. Receiving the psychosocial support. And avoid discrimination and stigma. And it happens in our own institutes, it happens in our own healthcare centers. We need to correct that first before going to the community. So a diagnosis should lead toward an appropriate care. In conclusion, an HIV result is a highly sensitive health information. For this, we need to have voluntary testing, confidentiality, responsible disclosure, including public health. And this is a part of ethical HIV care. There are many other components which I'm not touching today, but these are at least a part of ethical HIV care. Thank you for giving me the opportunity.